Hi, good afternoon. Welcome, everyone. Thanks so much for joining us for our first virtual meetup. Hopefully you can hear us all okay, and I can see some of the comments coming in. If you do have any problems with the audio or anything, just let us know in the comments, and hopefully we can fix those. But we've done a few test runs, and hopefully the technology should all be okay. We do want to make this meetup really interactive, so please comment on the chats. We've actually put two sections to this meetup. So we're doing the live talk on YouTube, which you're watching now, and then afterwards we'll have a separate session on Zoom as a virtual breakout session. And the idea for that, because over the last week or two, there's so many webinars I've been joining where they tell you you're a participant and then you're not and you're watching, and we wanted to make it really clear kind of when you can switch your cameras on, and also to recreate the networking side that we would normally have had at our events. Obviously, it's been quite a difficult time for everyone, and it's difficult not being able to be here in person and share things as we normally would, but hopefully this format works, and fingers crossed we'll be fine for the rest of today. Join us on Twitter as well. We're at Mobile UX London. We're streaming to YouTube and also to Periscope, if you remember when Periscope was a thing. So those of you on Twitter will be looking out for some of the comments on there as well, but YouTube is the main area. We'll also be recording this session, so no worries if you can't stay around for the whole thing. We'll send out a recording afterwards to everyone who signed up via email. If you haven't signed up and you're just watching this stream, on the YouTube below there's an Eventbrite section. If you just register there for a virtual ticket, we'll be able to send you the slides and details afterwards. We also want to say a big thank you to Adobe XD, who are sponsoring us today. We'll be sending out a feedback to everyone who's registered to ask what you thought about this format and other topics you'd like to see us cover. They've been grateful to give us a free 1-year Creative Cloud license to give away. So those of you who take part in the survey, we can select one winner at random and you'll get free Adobe Creative license for the year. So as I mentioned, there's two parts to today, the talk here and then the session on Zoom. The Zoom breakout session is full. So we have had just short of 100 people sign up to that, which is the limit of our account on Zoom. So we'll be looking to see how that runs. I suspect people who have registered, it's an online event, it's free. Probably not everyone's here or taking part right now, but we'll see how it all works and how we're doing. I just want to talk briefly about our program and our focus for upcoming events and what we're looking to do. As it says on the screen, this is part 1. So we're looking to do a series of virtual meetups because COVID is obviously it's impacted all of our lives and it's such a major topic. And on the news, there's a lot of doom and gloom, and rightly so. But we wanted to put together a program of events focusing on practical solutions because as the tech industry, there's lots that we can do. And our speaker today, Ozlem, who I can see she's ready to join us in the waiting room, which is brilliant. She's doing fantastic work supporting those those of you who don't know Babylon Health. It allows people to connect with their GPs via a phone app, and they've worked relentlessly on their COVID-19 care assistant to focus their communications around the challenges and everything that's going on at the moment. This is, as I mentioned, it's the first in this series. We're looking to do another event in a couple of weeks, probably around the role that you can play in mobile technology and how the processing power of mobile phones can be used to support the research and some of the data crunching that's going on at the moment around COVID-19. And then we're also looking to do an event around well-being and support for managers and staff, sharing tips and practical advice, what some companies are doing to support everyone during this situation, how we're finding remote working, and potentially also looking, speaking to someone in the recruitment sector around employment and opportunities and all the challenges that are going on at the moment. So that's kind of enough from me. I'll be here, I'll be looking out for the comments and get in touch, let me know if there's questions. We, as I mentioned right at the beginning, want to make this interactive and to listen to you throughout, and then we'll have the session on Zoom. It's now my great pleasure. We'll hand over to Ozlem Williams, who's the product designer at Babylon Health. As I mentioned, Babylon have been doing fantastic work in this area, and she's prepared a really great deck for you today to kind of talk through all of the areas that they've done, how they've rapidly prototyped and still reiterating and developing this product. And it's a great example of something they've brought to market so quickly and how they're responding to some of the challenges and the issues that are going on at the moment. So if I don't say this later, I want to say thank you to Ozlem for the great work that you're doing and for taking the time out to share this with us today. So I'll now add Ozlem onto the screen. And
hey, how are you guys?
Hey, how are you?
Good. Since Amazon, how are you doing?
Yeah, really, really good. As I was just saying at the intro, it's brilliant to have you here today, and thank you
so
for putting all
much.
of this
It's
together
great to
and
be
sharing
here.
everything. So how you're all okay? How are you feeling today? You're doing
quite
well?
busy. Yeah, I think it was last week. I had a nightmare. Like I wake up and you call me and oh my God, I don't have any deck ready. And I was the one, what am I going to talk about?
It's those sort of event dreams. I think you get those a little bit when you're prepared, because we were talking about this for some time. So you kind of feel, the day gradually gets closer and closer, and you think, is it Tuesday yet? What day is it?
Yeah. So I need to give the credits to our marketing and PR team and product team for this amazing deck. So this was one of our huge external deck. So I tried to make it shorter a little bit. So because we don't have much time, and I need to catch up a story mapping sprint afterwards. Yeah. So I'm Ozlem Williams. I am the product designer at Babylon Health. I'm mostly working on the voice and conversational UI, and right now definitely conversational UI. And my whole focus is on this COVID-19 care assistant. So there are different teams and teams working on this care assistant, because it's a end-to-end patient journey. So there are different features involving in it. I am responsible mostly the questions mostly people are asking and finding information around. So we are gathering those information and creating some categories, etc., and using some marketing teams. They created amazing videos and some articles, etc. So I'm mostly focusing on that part, but I'm going to take you through the whole journey today. Not too much detail, because app is there. If you want to try it, you can. And also I include a demo video here. Also, if you're ready, we can start.
Perfect.
Yeah. So, quick overview. At Babylon, as the whole world, we see increasing numbers of questions and concerns around the health conditions, especially focused on COVID-19. And so our main job is to make this health, suggesting health solutions to NHS and some private health companies and customers, private customers, our patients. So for COVID-19, we thought that we had to create a separate specific user journey, patient journey, that they can find all the information together, because people, if you remember when it all started, we didn't know much about it. Even doctors, clinicians didn't know much about it. So, and think about the patients who get the virus or who thinks that they have the virus. So you can call NHS or this number, or you should go to hospital or shouldn't, stay at home, how long, etc. So we thought about all these and worked on a story mapping, and we created some personas. And our aim was to help the government and hospitals and clinicians, doctors, to decrease the number of people who are calling 111 and going to the hospitals, and also try to help the users that they can find reliable information, and then they can check their symptoms and monitor their health. So it was our main aim. We can go to the next slide. So we focused on firstly creating personas. So who are we going to create this product? So we came up with 4 risk profiles here: low risk, medium risk, high risk, and escalated. So low risk, who has mild symptoms and not urgent, the situation is, and medium risk, who has fever, minimum 10 days, and high risk and escalated risk. So we worked on these profiles and we created some personas, and we came up with our product. So first of all, I want to share the product demo with you guys. Then when I describe detailed, we are all going to understand it better, the journey. So let's watch the video together.
Yep, perfect. What I'm going to do, I'm just going to put us both onto mute, so the video's going to
Meet the Babylon COVID-19 Care Assistant. It's designed by doctors using the latest guidance to help you manage your COVID-19 illness. Check your symptoms. The Babylon Symptom Checker can recognize what might be COVID-19 symptoms and suggest possible next steps. You can use the live chat feature to ask questions and receive answers from a member of the Babylon team. Receive a care plan and track your symptoms. You'll get daily notifications to input and track your symptoms, including your temperature, to understand if you're getting better or worse. You will also receive information for isolation and other helpful tips for physical and mental well-being. Speak to a healthcare professional. After you enter your symptoms into the symptom checker, it will indicate possible next steps. But if you believe you need to speak to a healthcare professional, you can book a video consultation with a clinician via your smartphone or web. The Babylon COVID-19 Care Assistant helps make it easier for you to take care of yourself and the ones you love. Try it today via the Babylon app or visit the Babylon website.
Great. I've added you back into the audio, so we can hear you.
Great. Yeah. Okay. So the journey slightly changed since then, because this was the first rollout, I can say. We had to be fast because it was agile. It's a new definition of agile, I think we all experienced since while we have this COVID-19 case. So if you go to the next slide, I'm going to, this here. So so when we were thinking about end-to-end patient journey, we came up with these steps. So the first one is inform. Next is decide, connect, monitor, consult, and refer. So if you go to next slide, I'm going to talk about them a little bit more detailed. So before that, why we came up with those 7 steps, because we tried to decrease the pressure on the healthcare providers. So as you know, Babylon is working for the healthcare providers, and we are providing some of our products. And we are providing products for the governments and also users. So here, for healthcare providers, we want to create this COVID-19 care assistant because there is a high patient demand, burden on healthcare providers. And also, you know that clinicians were also in isolation, most of them. So they needed this virtual consultations, and also disjointed solutions. This part was very important actually, because if you go to app stores or Google Play, you can see lots of apps right now that provide some sort of symptom checker, but you can't find anything that gives you an end-to-end patient journey where you can check your symptoms, talk to a human, and then talk to a clinicians and monitor your health. So it was our main focus. And next slide. And also this pandemic puts a huge strain on governments, as we all know, and population health at risk, high economic costs, and I don't know if I should say that, but unprepared crisis response and control. So to be able to help government, we had to consider all these points as well. And next one, also huge strain on insurance companies, how we are helping them because they are facing with increased cost and margin pressure at the moment. They have operational burdens, impacts to market share and brand reputation, strained market dynamics. So I am not going to go through all of these very details. I just put them here so that you can later check them, because I want to focus on the more product. Yeah, let's go to next one. So here, inform, the first step, let's talk about. So as I mentioned before, users are, I'm saying users because I'm a product designer, not I'm disrespectful. Patients are looking for clear, understandable, easy, digestible, and more importantly, reliable information. So we are providing information to the users which are specifically prepared by our clinicians and medical writers who are also doctors. For the Inform, our marketing team, they created amazing videos that how you need to take some precautions, how to use mask, when to use them or not to use them, or how to self-isolate, how you can manage your mental health, etc. So in our product, Care Assistant, in the app, we also covered all these information as like kind of short topics. We created categories, and then we use all these kind of informations, and we iterate them for our app itself. And next one, decide. This is one of the, yeah, this, I just talked about this, sorry. Yeah, all information you can find on web, on YouTube, and also in our app. We implemented all of them in. And decide, we can go to the next slide because I'm going to talk about it. Thank you, Brett, for your help on this. So
you're welcome.
Our symptom checker is one of our main features that we provide for government GP attend, as you know, and also our Babylon private users. So it is based on AI, and you can check your symptoms. And so our clinicians and engineers retrained our model for specifically for COVID-19 Care Assistant or COVID-19. So you don't have to go through the whole symptom checker. You just have a shorter version of it. So you go through it, and then it triage you according to your symptoms, as I explained before, according to those 4 risk profiles. So then it decides if you need to talk to a clinician immediately, or call 111, or go to the hospital, or just talk to one of our advisors. And next one, connect. So it is again a very important stage in the user journey here. We are providing live chat, which is kind of not easy these days to talk to a human. So especially these people are advisors trained by our clinicians, and sometimes clinicians themselves. They are answering users all sorts of questions, which if they are not answered before that step. And you can talk to them, and then they can again direct you to a clinician, or whatever your needs require. And next one, yeah, here you can see some of the UIs, how it works. Yeah, so they update all the information according to government guidelines, what sort of information they are going to provide. And anything else that I need to highlight here? No. Okay, we can go to the next one.
Mm-hmm.
Yeah, this live chat, you have.
Cool. Ozlem, your microphone's just dropped off, so we can't hear you at the moment. I'm not sure if you're able to check your connection. Cool. Your microphone's just dropped off at the moment, Ozlem. I'm not sure if there's if you can check if you're on mute or if your headphones are still connected. No, I still can't hear you yet. I don't know if there's anything. If you check, if it says if you're off, there we go. You're off mute.
Yeah.
Start from this slide again, because you dropped off just as we started on this slide.
Okay, this
so
is
you
a
just
quick.
pick up from this one.
This
That's
is
great.
just the kind of summary or the previous steps. So you go through a triage, and then a symptom checker, it triages you to the next steps. And one of the next steps is talking to advisor on your symptoms. And afterwards, we have this step, which is monitor. Here you can check your symptoms, and it sends you notifications during the day, how you are doing, which is I think very important. And it keeps you on track, and you see how it is improving or going worse, and then you can take actions accordingly. And then it is sharing, this monitor part is sharing new articles with you, new information, and keeps you in track of your mental health and your overall health, and of course in terms of COVID-19. So I share some UIs on the next screen. So yeah, it asks step-by-step questions to track your vital signs twice daily in app. It reminds you to check your symptoms, and it gives you some guidance, which is, to be honest, I'm pretty proud of sharing with. Our monitor team is doing great as well. Okay, next one. Yeah, again, this is a more detailed journey in the monitor. So you get the notification. I was, the previous one I was going to just go through quickly. So Yeah, you click on that. After you go to went through the symptom checker, you have this care plan, which is tracks your symptoms, etc. You create your care plan, and according to your care plan, you get notifications, and it checks your symptoms daily. It shares more the activities and the steps that you need to take, and checks your symptoms overall, basically. Next one.
Yeah.
Thank you. And this is consult. Again, when we are talking about end-to-end patient journey, this is a very important step. Like it's difficult to find anywhere else, because this is one of the main things which Babylon is the pioneer of, virtual consultations via phones or video. If they need consultation, they can have it via video or audio, or if they really need it, they can have face-to-face appointments as well with our GPs and clinicians. Yeah. So before going to localization, I want to quickly talk about the content. Again, as I mentioned before, our content team are working in line with the marketing team, because they are creating content. The doctors are creating the content, medical writers are working on them. So we are working in line with them, and we are updating our content daily basis, and we are trying to create a clear content, and taxonomy is very important because we are a global company in every countries, and in different touch points we are using the same, trying to use the same taxonomy, and we are creating some guidelines, style guides, etc., just specifically on COVID-19 as well, because it's a very sensitive topic. Health, of course, sensitive, but COVID-19 is more right now. And yes, we can talk about localization. So we have this product. Of course, we are still working on it, iterating, and still there are some points we are working on. And but we are live in the UK, and soon US, Canada, Thailand, and we are exploring Brazil and Italy at the moment. While we can go to the next slide. While we are doing it, we are taking some consideration, especially in triage advice, because all health conditions has its unique symptoms. Sometimes it differs from country to country, local to other local, and content information and how we are talking, what kind of words we are using, and we are also considering the culture. For instance, for our digital design, we are remodeling it according to the religion in the locale and language they use. And also we are iterating and implementing the UX and UI accordingly. And the next slide, quickly, I'm just finishing.
Okay.
This is our future plan, the next one. So in terms of the design, we had to use our existing symptom checker UI, because we had to be fast and deliver the product as soon as we can. So we are using the symptom checker design at the moment, but we are working on a more conversational UI right now, which you are going to be able to use some free text. It's going to allow you, and we are going to have some chips and text compilation, completing the text while we are writing. Those kind of different components we are going to be using. So this is something like a piece of info I just want to share for future. Yes, I think I covered it all basically.
Awesome.
Yeah.
And I know,
Okay.
Ozlem, when you spoke before back in last year in October, we held a meetup all around voice design. I remember conversational design is your area and your passion, and it was great to hear about, you know, the storytelling and the localization. And just on this slide, I was thinking, you know, the conversational, there's so much information that people, and this whole new vocabulary that we've learned in such a short space of time, you know, around self-isolating, and, you know, everything's new and being changing. And we've had about 77 people watching at the moment, which is really good, and how we thought. And I've got 6 questions from the viewers, which I want to put to you. But first of all, I just wanted to ask about what are your processes for managing all of this information, and information that's changing and continually updating? And because I imagine normally of a product, you know, you have quite a straightforward roadmap, and this kind of, you know, you've got a lot of existing infrastructure there, obviously.
Yeah.
But, you know, how do you deal with that flow?
Yeah,
and
we
how that's
haven't
changing?
we haven't handover and approval process which we created. So the content is creating one source, and then if we want to use it, for instance, for different touch points, you need to change it a little bit. For instance, if it is more conversational UI, you can't basically use the web content as it is. So after you make those little changes, you share it with the medical team again, with the clinicians, you get the approval, and then you hand over to legal teams, and they approve it. And then we put them for Q&A for the care assistant. I should say that we are working on Q&A maker. We have our own knowledge base, and we are working on that. If there is an update, so it's like, alert,
everyone change, go, get this right. Yes. You know, the guidance is evolving every day. I mean, it's a struggle to keep up.
Almost
sometimes.
Every day we are having content sprints and review sessions, the whole content team. So, and we are updating them regularly every day. Yeah.
Yeah, great. So I just want to go to some questions, and I'm going to put some up on the screen. So the first one of the questions we had was from Savraj, who's asking about the demographic for the app. So I wondered if you could just take a step back and explain, for those who might not have heard of Babylon Health, just about the audience and who you're working with. And the second question that came into this was around the personas. So if you could speak briefly about the demographic, and how you got, Susie's question was how you got to those 4 personas that you're using.
Generally, the target of Babylon Health is everybody on this planet who we think that everybody needs to have free access to health. In some countries, it's impossible to get health services. It's difficult. So our aim is to put accessible and affordable healthcare in the hands of everybody. So same aim applies to COVID-19 care assistant as well. So I can basically say everybody. So our target is mainly, I can talk about 3 different target audiences. One is governments. Second is health providers, like it can be hospitals, insurance companies. And the third is let me call them end users, people who wants to use it. Yeah.
Great, thank you. And another question just following from that around the users. So do you charge, question from Shani, do you charge for these services, and how does the pricing modeling work?
If you use GP at hand, it's all free. All of these services, not care assistant. But we also have Babylon Private. For instance, if you don't want to move your GP to GP at hand, then you can use Babylon private. I don't know the latest prices, but I can get back to you. I just don't want to give wrong information.
Yeah, of course. Yeah, no worries at all. So another really good question that came in from David was around dealing with the anxiety and how customers are quite stressed. I know you talked about the live chat and the monitoring and the AI, but as we know, the AI doesn't always get it right, and you still need that human interface. So it's great that you've got the obviously the video consultations.
Yeah,
but has this been taken into the design considerations of how you deal with anxious or stressed?
Yeah, this question is going to be more relevant for the feature design. I just shared with you, because we are going to have free text, and then we are going to have more issues probably around language understanding and machine learning. Right now, we are not using free text. As I said, we are using the symptom checker UI. So you are just go through the journey and click some buttons, and it takes you to the symptom checker and then the live chat, etc. I need to ask our customer support team and the advisors if they are dealing with these kind of anxious and stressed patients, let's say. Probably they do, and they are trained for that by the doctors and clinicians.
Yeah, great. So another question we had through is around the data. So Jennifer asked, is the data captured in the app also used for official statistics, or is it private data?
Our whole operation is compliance with this European data laws. So we are not using any data if the user doesn't want us to, but it's better if we ask it to one of our legal people.
Yeah,
I'm just
course. I mean, you're focused on the product area. Yeah, you're not here.
I'm like,
I mean, that's yeah, that's how we normally operate with these meetups.
Yeah, we all
are actually doing the designing.
We all have to pass those tests, legal tests, etc. We have to learn all of them, but I don't think that I should be answering these kind of questions. I don't want to say anything wrong or
completely understand. Fair enough. Great. And then one final question I had through was from Charlotte. And first of all, she asked about the user research. So how much user research has gone into this, and then also how the approach, how it takes into account the ethics of research for people in a time of high anxiety, if they're worried about their finances, if they're sick. I mean, I guess that's, you're normally dealing with people with health issues on a daily basis. So I don't know if this is a question for you or someone in your user research team.
Yeah, I think user research team. I can only talk about the user research which we held for testing the UI. So for that, you don't need to work with only sick people or who have some symptoms. They can be anyone. You just try to see how the app functions actually, if the UI elements work or not, etc. So I can only talk about that part, because this part is more serious, and our clinicians are involving in those research. So unless I read the whole outcomes of those research, I can't answer, but I'm happy to direct you to the people who can answer this very clearly.
Yeah, brilliant. And I just had one more question which came through, which is one for me actually, from Valerie. So I mentioned at the beginning, thank you again to Adobe who are sponsoring this meetup. So we've got a year's Creative Cloud license to give away. So anyone who registered for this event on Eventbrite will receive the email, and then they're the people who I'll be emailing a link for some feedback feedback and your thoughts on future topics. So as long as you're registered on Eventbrite, if you scroll down on the YouTube description, I've included the link to Eventbrite right at the bottom. That should still be live. But if not, you can always, I'll just pop my email up on the screen as well. So, I mean, if you have any questions about this event or future events that you want to know about, my email is brett@mobileuxlondon.com. So you can just send me a message, and I'm happy to share anything that I can. And as I mentioned, this is being recorded, so we'll send that out once I've finished the stream. I should get a recording, and then we'll send out a link to that and the details of the feedback, hopefully this afternoon, if not tomorrow. So I'm just going to hide the screen. And then, so thank you again. Thank you so much, Ozlem, for your time today and sharing those bits with us. I mean, the deck was incredible. When we spoke, you've given so much detail, and it really shows that, that there's so much that goes into this and everybody's health. And, it's a really complicated picture. So it's not, it's not straightforward at all, and everyone's got different things and at different stages of this. Yeah, it's incredible. Yeah, thank you again for all of the work that you're doing.
Thank you.
Yeah, really, really good. Thank you for your time today. I'm now just going to introduce you to Adrian, who is running our UX Academy courses. So as well as doing virtual meetups, we also have a training section to the business, which is UX Academy. And I'll just add Adrian into the stream now, and he's going to talk through about some upcoming courses, along with a webinar which is taking place next week, which is free, and you can join in, and that's around conversational design. So if you're interested in learning more about designing for voice, I'll hand over to Adrian because I'm just doing his pitch. But yeah, Adrian, you're on the stream now, so we can hear you.
Awesome. Well, good afternoon, everyone. Fantastic presentation by Ozlem, by the way. I hope you guys all took something from that today. So I'm Adrian, as Brett has just mentioned. I'm the head of growth and partnerships over at UX Academy. And for those of you that don't know much about us, we are a very successful training organization that's been running for over 3 years. We teach UX design courses in the evenings, and it's really popular because people are able to base them around their schedule. Now, what's great is that we've recently actually been able to take the courses online since March, and I'm sure it's quite convenient based on the current situation that's going on right now. Just to mention, we are actually running a free taster session for one of our upcoming courses, which is voice design, also known as conversational design. So I'm inviting all of you today on the Meetup to take part on a free taster session to be able to learn what it means to be a voice user experience designer, or even a voice user experience designer. This will be a great opportunity to join us for a presentation where you get to learn how to build Alexa skills, or to be able to build skills around voice activated devices. So if you're interested, on the slide right now, what you should see is a link. So feel free to visit rebrands.ly/voice webinar May. I'm sure Brett will be able to share some more information on that, and I'm going to hand over back to Brett. Brett, thank you.
Yeah, perfect. Thanks so much, Adrian. Just going to take that deck off. I just want to share, so on the comments we had lots of thanks and praise for Ozlem, so thank you so much again for sharing all those great bits with us. As I mentioned, we've now got a virtual breakout session which is taking place on Zoom. I'm just going to end this stream and then start the Zoom meeting because I'm running it all from the same laptop and I don't want everything to crash at the same time. The link is, you should have an email with the Zoom link, and there is a password as well, so just check your email for the details. If not, get in touch if you have any problems, but we'll head over to Zoom. So if you join the Zoom room, I'll see you over there shortly. Thanks very much, everyone. Take care.